Hello, Dr. Tugbiyele here, urogynecologist, and this week I wanted to create a video to help women who are considering surgery for prolapse or urinary incontinence. We know these are conditions that affect many women, and as a urogynecologist, I see this day in, day out, week in, week out. Women who have prolapse will complain of pressure. They may have difficulty emptying the bladder or bowel. Some women may notice a bulge in the vagina. They may notice a protrusion, something falling out sensation, or something in the way or misplaced. They may feel they have to lean forward or tilt back to empty the bladder, have a bowel movement. Some women have to push up vaginally or on the perineum to empty the bladder or bowels. With incontinence, some women would notice leakage, whether it's with activities like laugh, cough, or sneeze, jumps, lift, exercise. Some women is during intimate times, during intercourse, that they notice leakage, and other women, they may have it with regards to an urge. They don't make it to the bathroom on time. They may get up frequently at night from sleep, or go frequently during the day, leak and not make it there. Some women don't leak. They just have this urgent sensation all the time. After they've gone, they feel like they have not completely finished. So we see this, hear this day in, day out, and we talk to women about initially about their non-surgical options. One of which being pelvic floor muscle exercises, or Kegel exercises, we say. These are the muscles that women would squeeze to stop the flow of urine, or stop gas from coming out unwantedly. And my typical mantra is 100 Kegels a day keeps the urogynecologist away. And so in order to really benefit from these exercises, women have to do them frequently, just like any exercise that's meant to tone up the muscles. Woman can choose to do the Kegel exercises on her own, or see a pelvic floor physical therapist, kind of like a coach who will coach her through her exercises and make sure she's doing them and make sure she's improving on the strength of her pelvic floor muscles. A lot of my patients have said, "Doc, I've been Kegeling all my life and they've not helped." They may help with, they may say that, oh, it helps with incontinence, but it hasn't helped with the prolapse. And I can see how we understand that, because with the Kegels, it's hard to make the bladder, rectum, or the vagina, or the uterus go back up against gravity sometimes. Kegels and exercises may help relieve the pressure or falling out sensation associated with prolapse specifically, but it may not totally eliminate the bulge, if there's a bulge already there. And some women may still leak and it not be helpful enough. And then there are other options like a Kegel, like a pessary device, which is comes in different shapes and sizes. They are devices that go in the vagina. They're fitted for women to help to relieve the pressure and help to re-support the organs in the hopes of helping prolapse and or incontinence. Some women choose this option if they're not interested in surgery, but other women may not like this option because it's a device that may have to be removed, cleaned, and replaced, especially for intercourse. And some women may experience some discharge and odor with it in place, not because of an infection necessarily, but because it's a foreign body, and that's how the vagina kind of manages that to keep things lubricated and keep the pessary from sticking to the vaginal walls and irritating the vaginal walls. And so then there are, of course, lifestyle changes, dietary or behavioral changes. We tell women to be mindful of things that can cause urgency or incontinence. Coffee, tea, sodas, artificial sweetener. These are bladder irritants, was the word I was looking to remember. And we tell women to curtail those kinds of things or in moderation. But there are times when, despite all of these options, women still feel like they are not improved, and that's where surgery comes into play. And definitely there are good options that are safe and effective, and that's why seeing a board-certified urogynecologist is very key. And there are different surgeries that can be performed. They range from abdominal surgeries to vaginal to laparoscopic to robotic. Now, I was trained in abdominal surgery. Haven't had to perform abdominal surgery in a number of years, since we have a lot more minimally invasive options, because we know that abdominal surgery, it takes longer to heal from versus a vaginal, laparoscopic, or robotic option. Women can heal faster, they have less bleeding, less pain, quicker recovery, and so there are definitely advantages to minimally invasive surgery. And the surgeries can be done either to re-support the bladder, the rectum, the uterus, the vagina, depending on what has lost support, and to address incontinence. And there's so many different options for either of those conditions. And it does entail a kind of thorough discussion for women to understand what the pros and the cons are and what their options are. We talk to women about things to consider prior to surgery, women's health status. A lot of our patients are healthy. They may be older, but they're healthy, and so they're able to undergo an elective procedure in a safe fashion. A lot of patients who have multiple medical conditions, we would have them be cleared by their primary care doctors or their specialists prior to surgery to ensure that they are optimal enough for a procedure, an elective procedure. And post-operatively, what are some of the things to consider? Well, a lot of procedures now that are done in a minimally invasive fashion can be done as an outpatient procedure. Insurance typically covers these conditions. Why? Because they affect quality of life. They're elective, but they affect quality of life. So I tell my patients typically the vast majority of women go home the same day. Some women may need to stay overnight to allow anesthesia to wear off a little longer, but most women the same day. When we get home, typically walking and stairs are fine. Back to driving, I would say really depends. I think for a vaginal procedure, usually I counsel 3 to 5 days, and for a laparoscopic robotic or more extensive procedure, it's closer to 5 to 7 days. But walking, stairs fine. Back to driving, we talked about, but no exercise, no heavy lifting above 10 pounds typically. A gallon of milk is 8 pounds, and we don't want those sutures to be disrupted prematurely before the repair is held and the connective tissue is set in. So we oftentimes will limit heavy lifting, but we tell patients, you can walk, you can do light things, but just reserve more strenuous things, exercise, intercourse, and those things for later. For a vaginal procedure, anywhere from 4, depending on the type of vaginal procedure, to 6 weeks. And for a robotic, laparoscopic, abdominal, more extensive procedure, it's closer to 6 to 8 weeks generally. And every woman's case is different, and but however, those are just general considerations. And we talked, of course, when women get home, we say walking is fine, and because we don't want there to be an increased risk of blood clots. So it's not the point that you can't do anything, it's just that you have to kind of take it easy. Back to work, a lot of women working virtually or distance-wise can return to work at home if it's not involving heavy lifting or if it's not strenuous. I would say generally within a week or so. However, a lot of patients who work outside the home or their work is more strenuous, then that's gonna dictate when they can return to work, whether it's 2 weeks, so 4 weeks, 6 weeks, or even some women who have no choice and they do heavy lifting as part of their job, it may be at the 8-week mark or beyond when they can then resume that kind of work, because it's just like exercising and it's strenuous. And so there are different things to consider. Definitely, hence seeing a board-certified urogynecology specialist is key, because we can go through the pros and the cons, the ins and outs of different options, and what to expect before surgery, after surgery, so that you have the best outcome. We have very extensive training beyond college and med school and OBGYN training. Like myself, I did a 3-year fellowship training in reconstruction and urogynecology to learn the techniques and learn the entire knowledge base and the skill sets that's important for taking good care of women in this day and age. I've been practicing for close to 20 years now, and I definitely have seen thousands of women and done hundreds and hundreds of vaginal procedures, close to 1,000 robotic procedures, and and laparoscopic procedures, and able to offer these in a safe fashion that's effective. And so definitely we tell women that seeing a urogynecologist is key, because we bring to the table both the urologic as well as the gynecologic knowledge and skill sets for women who have issues that kind of combine those two areas. It's important for women, particularly who are considering surgery. Some women may seek and desire a second opinion. They've gotten one opinion for a surgical option, and they may question whether that's the best for them. Yes, definitely, we would welcome seeing you and for a second opinion, and giving you our assessment, especially with the type of experience that I have. I've been able to counsel women on what all their options, and then they decide which one is best for them. A lot of women may have been told, oh, you shouldn't use mesh, or you should use mesh, and they're confused as to the safety of, or the use or the need for, or lack thereof. And so it's, again, very important to seek care, to have a good conversation about the pros and the cons of each thing and each option, I should say. We review records, I'll review your records, and then come to a plan with you that you feel comfortable with. For patients who are out of town, again, we would help to arrange those accommodations so that you can be seen. Typically, that assessment can be done on the day you arrive. On the day you come for your consultation, so it doesn't require back and forth visits to the office. And so I know I shared a lot, but definitely seeing a board certified urogynecologist is key because, again, we have the education, the expertise, the knowledge base, and I've been taking care of women for so many years. I do care about patients, about my patients. I have a wife, a sister, daughter, mom, and so I always tell my patients that I get it, and women need to be cared for well. I thank God for the work I do. I feel like He's given me these gifts and skill sets to be able to take care of women, to help improve their quality of life. So I welcome the opportunity to take care of you. These are very common conditions. I tell my patients that affect many, many women. You're not alone. The women who have children, live life long enough, heavy lifting, constipation. Again, 25 to 50% of women have an issue with how they empty their bladder, bowel, or with prolapse, incontinence. And so seeing a specialist and getting the right solution and treatment is key to improving your quality of life. So thank you, and thanks for listening. And if you're interested in more information, you can visit my website, that's Dr. Stephen Tugbiyele, Stephen with a PH, tugbiyele.com. My practice website is Northside Center for Urogyn, that's urogyn.com. And the office number is 470-325-1280. My YouTube channel is available. I have a lot of videos and more to come that educate you on more options for pelvic floor conditions. Thank you. Until the next video, be well, be safe. Take care. Bye-bye.